Hey, hello there. This is Dr. Mark McRae from McRae Plastic Surgery and McRaePlasticSurgery.com. And I'm here to discuss with you today dry eye treatment after eyelid surgery. So eyelid surgeries such as blepharoplasty surgeries or eyelid repositioning surgeries, such as we call them ptosis repairs, where we're bringing up the eyelid margin. Any of these surgeries around the eyes can result in worsening of dry eyes. And so I'm just going to go through here the common treatments that we have for dry eye. Number one is the warm compresses. So something like a pill bottle with warm or hot water above 42 degrees Celsius. You can put hot water into the pill bottle and roll it over the eyelid, allowing the oils to heat up to a level that is going to cause those pores to unclog and allow the meibomian glands to function properly and produce an oily layer of tears. It takes about 15 minutes for those glands to kind of open up, allow those oils to melt down and allow the eye to get that nice thick layer of secretions on it. The second one is really eyelid hygiene. So 1 to 2 times daily you can use Systane towelettes. You can get those at the pharmacy, or for those of us that don't necessarily want to go to the pharmacy, you can just get soapy face towel, and that allows you to kind of clean away any scaling or any debris from the lid margin. There are some people that do have mites. They're called Demodex mites that have colonized their lashes. You see this more in elderly patients. They should wipe their lashes and have a face wash that includes tea tree oil. That'll actually cause those mites to go away. The third thing that can help treat dry eyes is omega-3 fatty acids. So it's recommended on those bottles to have 1 to 2 teaspoons daily. It thins the oils at the clogged lid margin. So again, we're looking at examples such as Nutri-C or other fatty acids that are available in pill form or in liquid form. The next option is lubricating eye drops. This is what we all think of when we think of dry eye treatments. So examples like Hilo, HydraSense, Systane, Balance, Refresh, Ultra. These are and things like artificial tears. Just something to note is that there are preservatives. If there are preservatives in the drops, like in artificial tears, then you should only be used 4 times a day. If they're preservative free, you can use them as often as you like. In terms of steroid eye drops, this is the next level up. Things such as Tobradex ophthalmic drops. This is useful if there's any inflammation or flares of blepharitis, different conditions. It is notable that there is this very small risk of elevation of intraocular pressures, so we want to make sure that you've at least seen an eye doctor at some point to measure your eye pressures and you don't have any risk of issues with that. The next step up from the steroid eye drops are ointments. Okay, so ointments are most commonly used at night since they do affect vision and cause some blurriness. And these such as Ocunox, Duolube, Fusophthalmic, Lotemax, and others. There can be oral medications that can be given to help with such as things like immune modulators like cyclosporin, other things that doxycycline or minocycline that can enhance tears as well. The next one would be humidifiers, so really modifying the ambient air so that there's not too much tears wicking away and evaporating off of your eye. So cool air humidifiers are very useful. If you can bring one to work or at your home, that can help you. Number 9 is really avoiding irritants. So stay away from environmental factors that worsen dry eyes, such as wind, such as smoke, such as air conditioning, dusty areas. Finally, rest and eye protection. This is the subject of another video as well that Dr. Matthew McRae has put out, so you can see this on our YouTube channel as well. But give your eyes plenty of rest during the initial recovery period. Avoid activities that are going to strain your eyes, like watching too much screen time and other things. Know that the actual flow of your tears isn't going to be normal, since there's more inflammation and constriction of the inflow and outflow of the tears during this initial period of time. And finally, there's something called serum tears. Now, serum tears are very interesting and actually quite useful. They can be made out of your own blood. You need to go to a special pharmacy to do this, a compounding pharmacy. And these get applied to the eye about 4 times a day. The really wonderful thing about this is they mimic the basal tear production quite well. So there's reflex tear production, so that's when you get emotional or cry. But there's also this basal level of tears that are produced by your eye. And it very much mimics those characteristics, all those different factors and different nutrients within them. And it's actually usually more concentrated than the basal tears themselves. So this really kind of gives your eyes the opportunity to really catch up. So that's a list of some of the options you have for your dry eyes, and particularly dry eyes after surgery. And again, let us know if there are any other topics that you'd like us to cover in terms of our educational content, which is again one of the big goals of our outreach.